Hello everyone, this is EMS Platypus and I wanted to ask you, how's EMT school going? Congratulations on surviving the first 4 weeks of the program. I want to make sure that you are prepared for the remainder of the semester. So, we have been giving you the information that you need so that your EMS knowledge base can really take off. The first few weeks of the program have been front-loaded with easier topics, or topics that we review regularly. The history of EMS is superficial, but documentation, communication, lifting and moving, and personal safety are things that we stress in the lab as well as in clinical. Medical terminology we will be using within the text as well as in discussion. And when we introduced things like anatomy and physiology or patient assessment, we were establishing strong foundational knowledge base. We were planting seeds of knowledge because we will be adding layers of complexity. We started with simple things like cells need oxygen, and oxygen enters through our airway and it has to be open and patent. Now we are talking about things that require a greater understanding, such as recognizing signs and symptoms of respiratory diseases or chest trauma and how they interfere with the ability to breathe, which means that the patient is not getting the oxygen that they need. Once you can correctly identify the problems, you will know the proper way of treating these issues. But what are we doing in class now? Well, class is a time for lecture? No, it's a chance for discussion to clarify main topics. Now, we will be applying simple skills, such as patient assessment, into our discussion or our lecture or even in the labs. And we will, in our patient assessment, we will analyze a situation to identify the need for a skill such as airway management. We will also be evaluating other signs and symptoms to identify the possible cause of our patient's chief complaint, and we will treat and reassess the patient as needed. And you can see how this information is going deeper and deeper, and there's a point for that. Remember the Bloom's taxonomy. Remembering or recalling is information from the textbook. Understanding simple concepts come from the workbook, but application, analyzing, evaluating, and creating, this is a category that National Registry is looking for and testing on. So, are we spending time in these higher levels of learning? Well, remember that we are not simply repeating the same information over and over again. We are trying to develop deeper and broader knowledge base. Is the class time being used efficiently? Well, test-taking skills are being talked about, and we need you to be able to apply your knowledge base in a multiple choice format so that you can successfully pass National Registry. But would you rather be sitting in lecture or practicing and training in the lab? Well, we know that lecturing alone will not make you pass National Registry. So what do we need to do to shorten lecture time? Well, you need to study at home. When you come in at the beginning of the day, if you ace your quiz, we can make the day a lot shorter in lecture and go spend time learning in lab. So you have to ask yourself, how am I studying? How much time should I be devoting for class? If you're getting straight A's, you're doing great. If you feel like you're not where you want to be, you have 3 options. Number 1, you can commit more time. Or, hey, how about opening up the book and starting to read and prepare before you come to class? can change your study habits if you are trying to read the book but are having difficulties. I've got a couple ideas for that. And if you're just not where you need to be, I want you to understand that the pace is about to pick up. So you should consider whether withdrawing from the program might be a better option than getting straight Fs. Now, getting back to study habits, are you asking the right questions? Initially, we were just talking about when and what. These were superficial questions. When the patient is apneic, what do? You use a BVM. But now we want to be asking questions like why and how. Why is the patient apneic? Why am I using a BVM? Why is he in respiratory failure? What other signs and symptoms does he have? And with that information, how do I fix it? So, I also introduced hooks. These are 1 to 3 distinctive signs and symptoms or key clues as to what's going on. For the patient above, if he's in respiratory depression, he has pinpoint pupils and track marks on his arms, you could consider it would be an opiate overdose, and it would be good for you to try Narcan to see if you could reverse his respiratory failure. So what should you do for the next 10 weeks? Well, the next 10 weeks is preparing you to take tests and know the knowledge base in airway, cardiac, trauma, medical, and EMS operations. This comes directly from National Registry. You need to successfully pass all 5 in order to get your NREMT certificate and therefore your state license. Now, we all share the same end goal. You need to be able to perform life-saving procedures without prompting or oversight, and that's the purpose of the state practical skills exam. Clinicals allow you to use your experience and your training in real-life exposure. And we all want you to pass National Registry on your first attempt. Now, our end goal is for you to be a confident entry-level EMS professional. So I want to make sure you are using the right tools and studying with the same end goal in mind. Good luck. If you have any questions, please feel free to let me know. Thank you. Bye.